So, hi everyone, and welcome to our virtual fireside chat today, all about mental health and virtual care. I'm Katie McNeil, and I will be your moderator today. So, today we have the board chair of Colleaga, Dan Gordon, with us. He'll be talking about global health system transformation and all of the amazing opportunities that are happening right now in the virtual care or the mental health care market. He'll also be discussing Colleaga's Virtual Care Open Challenge, one of the health system optimization challenges in Colleaga's Pandemic Recovery Challenge Hub. You can find more about it on our colleaga.org webpage, and we've also posted that link in the chat. So we'll talk more about the challenges in a little bit, but Dan, we're hearing so much about mental health right now since the pandemic started. Why is mental health such an issue right now?
Good morning, Katie, and good morning, everybody. It's great to be here today. Katie, mental health has become a much more visible issue over the past few years, partially because the stigma attached to mental health has lessened over time, and partially because of increased mental health pressure points, like in the last few years, the opioid crisis and increasing number of suicides. But over the course of the pandemic, different groups of people have experienced different kinds of mental health traumas. Firstly and most obviously, there are the population of young people and especially old people who've been infected by COVID-19 and have gotten very sick or seen friends or family around them die. And experiencing your own death is a classic cause of post-traumatic stress syndrome or PTSD. This kind of mental trauma makes people very fearful for the future, very anxious, and it can lead to depression and hopelessness, which all become a lot worse for older people living alone or who are in long-term care institutional settings. So social isolation has exacerbated that kind of mental trauma. The second category of people who are suffering from mental traumas are health providers. Doctors, nurses, emergency first responders, and many other people have had to make very hard decisions during the pandemic that may have resulted in a patient or a client not getting the care that they needed when they needed it and dying as a consequence. And the guilt that they could have done something different to save that person's life can cause a moral injury. And this kind of trauma applies also to personal support workers in long-term care homes, who not only fear that they can get sick or carry disease back to their houses and make their families sick, but also from guilt that they may have brought the virus into a long-term care home and caused the death of people that they are looking after. And the third, much larger category are all of those people impacted by financial and economic dislocation as a result of the pandemic shutdown. So the trauma is because of the shutdown, not because of the disease. People who have spent their lives knowing that they can earn a living, look after their families, bring them safety and stability, have suddenly lost a predictable future. And not having a job in the foreseeable future, not being able to take care of your loved ones brings hopelessness and enormous amounts of anxiety and depression. And in many cases, that leads to more alcohol usage, more drugs, more addiction, and in some cases, that has turned into domestic violence. So the pandemic has been the root cause of all of these interacting mental traumas, and it has created a huge increase in the number of people who need a continuum of mental healthcare services, from basic wellness and resilience tools to better primary mental health care to more access to specialty care for significant diseases. And the promise of telehealth and virtual care, and particularly virtual mental health services, is to increase the capacity and reach of health systems to give those people who really need it access to care and services.
Right. But hasn't telehealth been used for years now as a tool for healthcare system transformation? What's different about it right now?
Well, you're right, Katie. Telehealth has been around for many years, but almost always, as we used to say, it was the technology of the future that was always going to be in the future.
Mm.
15 years ago, I led a project for Canada Health Infoway, the Canadian National Electronic Health Record organization. We evaluated the adoption and use of telehealth across Canada. At that time, the most successful organizations were doing hundreds of thousands of telehealth visits, and that compared to 100 million doctor visits. So less than 1% of care used telehealth. But there were good successes in using telehealth to provide access to care for people living primarily in rural and remote communities. I remember speaking to a woman who lived in James Bay, which is just near the Arctic Circle. And she told us that she had left her 2 children at home with her mother, and she had taken her 3rd child on a 6-hour bus ride to get to a small plane, to fly to Toronto, to take another bus to Sickets Hospital, where she waited for a few hours for a 15-minute appointment, and then repeated the entire process to get home. And it all took her 24 hours. For people like her and her children and her mother, telehealth was life-changing. And it was being used for niche specialties like teledermatology. And with the right specialists, it was a very powerful educational tool to transfer new skills to doctors and nurses working in remote areas. And there they say the most successful telehealth was when those doctors or nurses didn't need them anymore because they had learned how to take care of patients on their own. And so that was state of the art 15 years ago. And at the time, some integrated delivery systems in the United States said telehealth is not just for people who are thousands of miles away, it's for people who are in the room next door. And they saw it as another tool to offer their patients and their customers a better experience and to gain efficiencies in the way that they worked. So they expanded the idea of telehealth beyond person-to-person video to all kinds of online services with emails and texting and all the other ways that we communicate electronically. And these kinds of best-in-class organizations made large technology investments, and they really expanded virtual care to the point where more than half of their visits were being done using telehealth. But that's not been the norm. Until earlier this year, most payers were still refusing to pay doctors for telehealth visits, and that really held back the mainstream use of technology. The other major force around us is what the futurist author Tom Friedman has called the computational supernova, this exponential growth in the power of technology. Since we did that telehealth study, the computational supernova, the computational power around us has doubled and doubled again and doubled again and again 5 times. The technology we have around us has created this incredible exponential release of technological energy, and it's amplifying all of our power of machines, of individuals, and of humanity, and of information flows. Everything's being digitized and stored and analyzed by more and more powerful software. That is the basis of artificial intelligence and machine learning. Machines are learning and applying what they learn to make new things possible and to do old things in fundamentally new and different ways. And so that's what makes it possible for hundreds of billions of us to go online earlier this year and start working from home almost overnight in one weekend in March. So what we're experiencing today is the confluence of exponential growth in technological power, decades of virtual care experiences, and a massive, massive demand for virtual care, and particularly virtual mental health.
So actually, I think now might be a good time to ask one of the questions coming from our online audience. We had a post in our community earlier today from Lance Malherber from South Africa, and he asked, Dan, do telehealth-enabled services really transform healthcare systems? What role do healthcare administrators play in virtual care business model, and how is patient data managed?
That's good questions, and there are a bunch of them there. Like any technology, more tech with poorly designed services just means a bigger technologically enabled mess. And that is what's happening in many cases. Doctors doing calls on Zoom with no access to the electronic health record, no integration, no scheduling, and no billing integration has just meant frustration and worse, more expensive care. And even now, we are seeing many physicians backtracking from that kind of virtual care. They just say it's just not worth it. But there are great new companies who are offering amazing new virtual care services that use telehealth but focus more on a great customer experience, on the user experience, and on a real value proposition. For example, Mercy Virtual can run your intensive care unit with their intensivists who are sitting in a data center thousands of miles away monitoring your ICU patients. It's a great service for organizations struggling to recruit intensivists. The other good examples are MindBeacon or Inkblot, who provide a range of mental health services, starting with online self-help tools such as journaling apps and reminders, to guided therapy with an online therapist, all the way to specialty one-on-one counseling online and in person. These organizations are creating a market space between clients who need a range of healthcare options and providers who can live anywhere geographically. And another trend is for these companies to build sophisticated population health analytics and create value-based care businesses. And they can predict which clients are at risk and what kinds of elevated services to provide in order to provide better care and avoid more expensive outcomes like emergency visits and outpatient visits and inpatient admissions. And they're also providing value-based business models where they offer care for a population for a fixed price rather than for traditional fee for services. And they can take this risk on because they've got the algorithms to identify risk factors and the resources to provide the right kinds of interventions so they can be successful at value-based care. So Lance, the role of healthcare administrators is not to focus on the technology. It's to focus on the new kind of services they need and new creative business models that they can build into their organizations, and on how clinicians can have access to the continuum of confidential and protected patient data that makes all of this possible. It's not about the tech. And it is vital for healthcare innovators and developers to be able to speak that kind of language. Those who can are providing business models in that kind of a way are becoming really valuable. And they're getting funded with tens and tens of millions of dollars. Investments in telemedicine companies and their valuations have been massive. A few months ago, we saw in Canada that Maple is building out a consumer-based care organization with Shoppers Drug Mart, and their funding round was $75 million. Earlier this month, On Call received an $8 million financing. And it's not just venture financing for scale-ups. There are also considerable financing opportunities for startups. $100 million through the Canadian superclusters and mini clusters, $50 million tranches in major US innovation communities like Colorado, the Rust Belt centered on Ohio and Indiana, the Boston, New York Innovation Corridor, and of course in California. All of these have early stage public financing opportunities ranging from $50,000 to $1 million available. And not only that, but they're all the health system investments for chronic disease, ranging from programmatic focuses on virtual cardiac care or diabetes all the way through to mental health. So what's common about all of these virtual opportunities is they require, of course, an understanding of technology, but more so, they require a sophisticated understanding of how to solve complex problems, how to get multiple stakeholders involved in solving those problems. And all of those require a collaborative approach and expertise in building workable consortiums that include public, academic, and industrial private sector interests. That's the $1 billion big picture opportunity that's in front of us now.
Yeah, and I mean, obviously right now there is a huge market opportunity for virtual care innovators. And actually at the beginning of our chat, we mentioned the pandemic recovery challenges that Colleaga is hosting. So I'm wondering, actually now, could you take a little moment to explain a bit more about why Colleaga is choosing to host those challenges right now?
Well, Katie, Colleaga has always been about creating social impact and building out complex mission-based accelerators for complex projects. Virtual care in particular is a complex project because it involves patients who may be the beneficiaries of the service. It involves clinicians who may work for different organizations, for example, a primary care doctor who has their own office and a specialist who may work for two different organizations. And it involves complex financing where different parties need to bring different kinds of financing to the table because often the organization that's providing the work is not the organization that gets the benefit or the organization that needs to fund the work. So what we're seeing is that healthcare entrepreneurs and clinicians have got great ideas, but they may not be able to effectively put together these kinds of business models. They may lack the comprehensive knowledge about health systems, or they may not have the right business expertise, or they may not have the tools to engage stakeholders in these kinds of dialogues. So we've created our collaborative competition to bring these players together to co-design projects. These are the kinds of complex projects that we are helping to succeed through our challenges. And through our accelerators and through our challenges and our community engagement events like this, we are aimed to produce a portfolio of 100 new ventures targeted at helping vulnerable populations who've been adversely impacted by COVID-19. And we're delighted to be bringing Colleaga Capital, which is our social innovation venture capital fund, to finance innovations in our accelerators and challenges so we can make a real difference in the way that healthcare is delivered. We're following this virtual care challenge with a series of pandemic recovery challenges to find solutions not only for virtual care and population health analytics, but also for improved testing, improved contact tracing. We are looking at a challenge for the vaccine supply chain, and we're also looking for a challenge that will focus on remote workforce transformation.
Awesome. We'll thank Dan Gordon for coming today to chat with us, and of course, all of you who joined the call today. If you do have any other questions, we do have an email that our Innovation Sherpa will put into the chat. So please reach out to us there. But you can also message any of our hosts on the community if you do end up joining. It's another way to get in touch with us. But on that note, I think I'll once again thank everybody for coming and wish everyone a fantastic day.